My name is Dr. Emma and I'm the founder of Eden Medical Clinic. When I opened Eden Medical Cork in 2016, my aim was to open a group of clinics across Ireland, specialising in medical aesthetics, so that patients could attend to address their anti-aging concerns and also learn about treatments to enhance their natural features. To date, we have 8 clinics across Ireland and Northern Ireland, with a growing team of medical professionals who specialise in medical aesthetics. We treat every patient who comes through the doors as an individual, and our aim is to create a tailored medical treatment plan which is just for you. One of the most requested treatments at Eden Medical is anti-wrinkle injections, and today I'm going to be using our patient model Kaylee to talk you through all of those areas. I'll start at the top of the face and work my way down. So the first area that we inject is the forehead, otherwise known as the frontalis. And as you can see, when this muscle moves, it creates horizontal expression lines or wrinkles. We can reduce these or effectively get rid of them at times using anti-wrinkle injections. The second most common area would be the frown line or the glabella. As you can see, this creates vertical wrinkles between the eyebrows. We can also reduce or effectively get rid of these wrinkles using anti-wrinkles injections. The crow's feet or the orbicularis oculi muscle can also be treated using anti-wrinkle injections to remove or get rid of these crow's feet in this area. The fourth most common area would be the bunny lines on the nose. We can also inject through here. Another common area would be the smoker's lines over the upper lip. So as you can see, when Katie is pursing, the vertical lines that come in here can be treated. Another area would be the chin muscle, which tends to dimple as we talk or speak and can create quite a pitted appearance on the skin. This muscle can also be treated. Another example of an area we can inject with toxin or anti-wrinkle injections would be the DAO muscle, which is a muscle at the mouth corners to depress the angles of the mouth. As you can see, this will create wrinkles in this area and create quite a sad appearance to the mouth, which we can reverse or reduce with anti-wrinkle injections. Another treatment we offer at Eden Medical is the gummy smile treatment. We would be injecting approximately here and here to ensure that the upper lip doesn't rise as much when you are smiling, therefore showing too much gum. We can make sure that the lip rises to a suitable level, hiding any excessive gum. Another treatment would be the lip flip, whereby we inject just over the lip so that the lip doesn't thin out or curl under as much when the patient is smiling. Another area of the face we inject using toxin would be the masseter muscle right here and here. If you are grinding or clenching your teeth, that muscle can enlarge and bulk up, therefore making the face a little bit wider. Even if you don't grind or clench your teeth, this muscle can be enlarged. And if you would like to reduce your bruxism or your clenching or grinding, and therefore the size of this muscle, and get some facial slimming in that area, we can inject this muscle using toxin or anti-wrinkle injections. If you have quite low-lying or straight eyebrows, we can do a brow lift using anti-wrinkle injections. We would do this by administering toxin throughout this muscle group and just under the tail of the eyebrows to ensure a nice, subtle and natural brow lift. Another area we inject using anti-wrinkle injections or toxin is the platysma muscle in the neck. As you can see, these vertical cords appear. If they are appearing frequently when you are expressing or talking, they also lead to neck aging. Hyperhidrosis is a medical condition whereby the patient in question would suffer with excessive sweating. We can use toxin injections to address and reduce this concern very effectively. The areas we would treat would be the underarm, the palms of the hands and the soles of the feet if needed. So it's been 2 weeks since we had Kaylee in for her anti-wrinkle treatment, and we're back today for her 2-week review to check out how her results went. So the first muscle I'm going to look at today is the frontalis muscle, which is responsible for the horizontal forehead lines. So I'll just get Kaylee to raise her eyebrows. Perfect. The second muscle I'm going to look at today is the glabella, which is the area in between her eyebrows, which would cause the vertical lines. So if you just frown for me, please. That's looking good as well. Next, onto the eyes, or the orbicularis oculi, or where we would see the crow's feet for Katie. So if you smile, please. This area is looking nice and smooth as well. And next, we will look at the bunny lines on the nose. So scrunch your nose for me, please. Perfect. You can see that they are very reduced as well. Now we're going to move on to the muscle above the lip, where we carried out the lip flip treatment. So if you just smile for me, please. Looking good. And next we look at the DAO, or the depressor anguli oris muscle, which is here to depress the mouth corners. So if you try and make a sad face for me, please. That looks good. And next we look at the chin muscle, or the mentalis. So if you just scrunch your chin for me, please. Perfect. And then finally we look at the masseter muscle as well, which is the muscle here at the jawline. So if you scrunch for me there and clench. Perfect. And that's feeling much softer as well. Profiloplasty, or profile balancing, is a treatment protocol designed to address the balance and harmony of the facial features as can be seen from a profile point of view. The main features we would address during the consultation for profiloplasty is the nose, lips and the chin. We would then carefully decide where to place dermal filler throughout any of these three areas to create a more balanced profile. For example, if you have quite a small chin, or lips that sit a little bit too far back, this may actually make your nose look like it's sitting a little bit too far forward. So by adding some filler at the chin point and throughout the lips, it will give overall more balance and harmony to your profile. Indeed, the nose can appear bigger if the lips and the chin sit a little bit too far back behind it. So if you wanted to bring your nose more into balance of your face, we would add little amounts of filler in the chin and lips to bring overall more balance and therefore make your nose look a little bit smaller. If the tip of the nose tends to come down, or there's any conspicuous bumps or anything like that can be seen from a profile point of view, the addition of filler in the nose will also help to make the nose look straighter and a little bit smaller. This treatment approach uses some subtle changes to overall address facial imbalance. So this is Mairead, and Mairead is back today for her 2-week review. She had the profiloplasty treatment done 2 weeks ago, and on analysis of the day, we decided to treat her lips and her chin to bring some balance to her profile. We treated the lips and the chin because they were sitting back a little bit, and we wanted to bring these forward to harmonise the balance between her chin, her lips and her nose. So the overall outcome is that when we look at Mairead's side profile, we see more balance between her nose, her lips and her chin.